Can a colonoscopy cause diverticular perforation? Imagine going in for a routine checkup and wondering if it could lead to unexpected problems. One concern some people have is whether a colonoscopy might cause a perforation, especially if they have diverticular disease. The truth is, yes, a colonoscopy can cause perforation of the colon, but it is a very rare complication. Perforation means a tear or puncture in the wall of the colon, which can happen if the procedure accidentally damages the lining. This risk is generally low, estimated between 0.016% and 0.2% during diagnostic colonoscopies. The risk can be higher, up to 5%, during therapeutic procedures where interventions like removing polyps are performed. The most common site for perforation is the sigmoid colon, which is the part of the colon that curves into the lower left abdomen. This area is more vulnerable because of its sharp bends, mobility, and sometimes fragile walls, especially if there has been previous inflammation like diverticulitis. In people with diverticular disease, especially those who have had episodes of diverticulitis, the colon wall can be thinner or weaker. This makes accidental tears more possible during the procedure. Features such as severe diverticulosis, which means many diverticula or pouches in the colon, or a colon that is fixed in place due to scarring, can make navigation more difficult and increase the chance of injury. However, it is important to note that colonoscopy is usually considered safe when performed after the inflammation from diverticulitis has fully healed. Doctors typically recommend waiting at least 6 weeks after an episode of diverticulitis before doing a colonoscopy. Doing it too early can raise the risk because the colon wall may still be fragile. During active diverticulitis, colonoscopy is generally avoided because the risk of perforation is higher. For people living with diverticulitis, colonoscopy remains an important tool. It helps doctors check for other issues like colorectal cancer and assess how extensive the diverticular disease is. The benefits of having a colonoscopy, especially after recovery, usually outweigh the small risk of perforation when the procedure is done carefully by experienced clinicians. In summary, while colonoscopy can cause perforation, it is a rare event. The sigmoid colon is most at risk because of its shape and the presence of diverticula. The risk increases if the colon wall is weakened by previous inflammation. To minimize this risk, doctors recommend waiting until the diverticulitis has resolved before performing a colonoscopy. Proper technique and patient selection are key to keeping the procedure safe. If you have diverticulitis, talk with your healthcare provider about the best timing for a colonoscopy and any concerns you may have. Remember, medical professionals are there to guide you through the safest options for your health.